Anut Nankunda's physical appearance leaves little to imagine about her discomfort. At 8 years, Anut has a big head which is almost twice the size of that of an adult. The condition Anut has is what is termed as hydrocephalus, a medical condition that makes people's heads abnormally big. Glued in a wheelchair, little Anut, wearing a faint smile, is wheeled by her guardian Robert Sunday over to where I'm seated, waiting to have a little chat about her condition. Sunday says Anut was born a normal baby with no signs of such abnormality.
She was born a normal child, and for about the past 2 months she was normal until maybe about 3 months old. That's when she started crying, and then we didn't know what had happened. But then we thought that it was normal for children to cry at 3 months old and things like that. But we didn't know anything that was happening.
He says they visited several clinics in Chivale where they resided then, but got no help.
Then slowly her head started to swell and her fontanelle, very different from a normal child. And then we took her to the nearest clinic in the village, and they told us that we should get her strong and take her to a bigger hospital, and something that they can be worked on in the village.
They even tried to use local herbs and other crude methods like burning her head with a red-hot metallic spokes.
We tried using local herbs, different local herbs, and smearing on her head, thinking that they'll help maybe the fontanelle to go back to normal and probably the head to go back to normal. And then that didn't work. The head continued to swell. And then we tried, a few friends advised us to use a hot iron rod, which we put in fire and slowly put on her head.
Sunday adds that although her head is still big, Anut now shows some signs of being able to support herself.
She used to have lots of seizures before she came here. Before she started the medication, she used to have lots of seizures, but now the seizures have reduced. She used to have like seizures about 3 times a day, every day. The medication has really helped.
Sister Olivia Nabirio, an occupational therapist at Katalema Church Home, explains that hydrocephalus is caused by a blockage inside the brain, leading to interference in the outflow of the cerebrospinal fluid. The condition causes the head to swell, putting pressure on the brain, and if left untreated, kills about 89% of the children.
First of all, hydrocephalus, it is the accumulation of too much fluid on the brain. We have brain cells that keep on producing fluid. This urine, once there are infections within the pathways or the spaces in the brain, this fluid will not flow very well. So this fluid will just keep on accumulating. Once it accumulates, it pushes on the pressure pushes on the skull bones, and then the head size starts increasing. Infections alone, they are not the only causes of hydrocephalus, but we also have the brain tumors can also lead to hydrocephalus. We have spina bifida, it can also lead to hydrocephalus.
The medical reports indicate that in Uganda, over 2,500 new cases of hydrocephalus are reported each year. Sister Nabirio points out some that all mothers should look out for.
It is always very important once you're pregnant that you go for antenatal checkups. Once you get any illness, always go for checkup and also early treatment. Most parents they kind of want to treat themselves from home. There are very many signs that you can notice that this child has hydrocephalus. Right away from the eyes, there will be sun setting. You see the black part almost going down and the whiter part up is also seen. You'll see pronounced veins on the child's forehead. The child will start vomiting. The fontanelle will not be pulsatile or will not be beating, will have reduced appetite, and will cry a lot.
She's now appealing to all expectant mothers to visit health facilities for antenatal checkups regularly until delivery if they are to avoid such life-threatening illnesses.
To avoid hydrocephalus, it is very important if the parents go for treatment early enough, if the mothers especially go for treatment early enough when they are pregnant, or even when they've delivered the baby. Some babies are born without hydrocephalus, but because of the negligence of the mothers, they want to provide treatment themselves for the kids at home. It is better to take the child for checkup by a medical personnel in a hospital health center, and also take the child for treatment early.
Well, you all have it. All you need to know about hydrocephalus. Don't miss tomorrow's feature when we shall be sharing a story of a victim of yet another rare but worrying condition called spina bifida. For KFM News, I'm Dana Wanyana.